The main goal is to create an environment where young people's sexual reproductive health and rights, information and service delivery is realized to all young people. Our primary target are young people between the ages of 10 and 24. So what is guiding us in the project? Of course, just like any other person, you need to have a guideline. We have long-term objectives, what we want to achieve at the end of the project. But we also have core values that guide us in our day-to-day work. First of all, we ensure meaningful and inclusive youth participation in everything we do. Young people are always at the forefront. Just like you see in the room, we have very many young people. Personally, I'm a young person. And we are here almost taking lead of everything. Yeah? I will also have youth-adult partnerships, not only focusing on young people, but also adults. Realize the room is very intergenerational in nature. We have adults, we have young people, we have elders, and maybe youth, right? And we are all at the same platform trying to sort of craft solutions to challenges or problems that young people are facing in regards to their sexual reproductive health and rights. Okay? I'll speak briefly about the goals. We have about 4 overall goals of the project. 1, access to age-appropriate SRHR information in Uganda and in the areas I mentioned about where we offer our services. That is 1. 2, we also want to ensure that we have a supportive environment, yeah, public support. When I talk about public support, now we see speaking about young people only. This is where the youth-adult partnerships come in. This is why we have duty bearers here. We have law enforcement agencies, representatives are here with us. We have cultural institution representatives here with us. We have parents and the young people themselves. We want to create a supportive environment because these are people that live with us in our different communities where we come from. 3, we want to ensure that we have a very favorable policy environment when it comes to young people's SRHR, okay? Because most of the things we do in this mighty country are driven by policies, okay? And policies are implemented to ensure effective service delivery. If not implemented, or if we do not have favorable policies for our young people, meaning whatever we are going to do shall be not so much effective, if I may say so. We'll also try to do advocacy or policy advocacy right away from national level to community level, where we are right now, and even in the communities that we serve. And finally, we bring organizations together with a strong niche or with a similar niche, and which is why it cannot be a one-man's effort. You heard about the moderator talking about an organization where she comes from. It is called Center for Health, Human Rights and Development. Yeah, it is an organization that also implements this project. We have organizations like the SRHR Alliance of Uganda also implementing the same project. We have Hope Mbale here that is hosting us today, implementing the same project. We have organizations like Reach a Hand implementing the same project, RHU implementing the same project, and very many other organizations. So we believe in the power of joint collaboration and implementation to see that we combine efforts together in a bid to ensure that young people have equal access to sexual reproductive health and rights. We were very intentional while we were selecting the areas of implementation of this project because we know young people are not homogeneous. Amongst young people, we have those living in urban areas. That's why we have some activities or engagements in Kampala and other urban areas of the country. We have young people living in refugee settlements. When you go to most of our interventions in Rwenzori, you realize that we will work with IDP camps and all that. And all those are young people. When you come to Elgon sub-region and Sebei sub-region, of course those are also young people that live in such communities. So you realize there is a balance. By the time we sat down and then crafted our areas of operation, we considered a lot of diversities in young people. So overall, we want to ensure that there is equal access to young people's sexual reproductive health and rights, and creating a supportive environment. There is a lot of work that we have done, and we want to thank Hope Mbali for taking lead in Eastern Uganda and in the areas that we operate in this side, because they are our face, and it is the reason as to why we are here.